Diabetes on its own accounts for 10% of the entire NHS budget. And of that, the diabetic foot, as it's known, so £1 in every £150 spent in the entire NHS is spent on looking after the complications of foot disease in people with diabetes.
The main one that we see is problems associated with nerve damage, which can happen when your sugars have been too high for too long, and patients can have a whole raft of problems associated with that, including painful neuropathy, where they can get burning and tingling, hot and cold sensations, feeling like they're walking on pebbles, all sorts of horrible things.
It's the very, very finest and thinnest nerves furthest away from the brain that are affected by long-term poorly controlled diabetes, and they tend to be the sensation nerves in the feet.
Nerve damage can also affect their protective pain sensation, so that they can't feel if they've got a blister or there's something in their shoe or they've stood on a drawing pin or something like that.
So for example, if somebody cuts their toenails a bit too short, they don't feel it. And if you open a wound, then all the bugs that are on the skin will get into the wound, and the bugs will love all that extra sugar. And so you've got immediately a risk of having an infection in the foot.
Nerves don't just affect the sensation, they also affect the skin's ability to sweat. So you can lose the ability to sweat in your skin, which can cause your feet to become very dry, which is why you need to moisturise regularly.
If I'm not careful, I get very hard, dry skin on the bottom of my feet. So I do have to cream my feet every day. And in the past, if I've had dry skin underneath and they've cracked and been sore, so I know now to keep them well moisturised and not to allow them to get like that.
The other thing that happens is that if you have narrowing of the blood vessels, so people with diabetes will often have narrowed blood vessels, which is why they have an increased risk of strokes and heart attacks. But if you have narrowed blood vessels down in your foot as well, then trying to get the stuff in the blood that will help that wound to heal and to help fight infections, you physically can't get the stuff down there. It's like sucking treacle through a cocktail straw.
Non-diabetics also get peripheral vascular disease, but diabetics tend to get it more aggressively, and it tends to be in the smaller blood vessels further down in the leg, so it's actually harder to treat than for a non-diabetic. And also in combination with the nerve damage, they can have a problem where they sometimes can't feel that they've got the poor circulation. Often they will, without the nerve damage, they would feel pains in the calves and cramping sensations if they were walking, because the oxygen's not getting to the tissues. But sometimes the diabetic patients who have nerve damage as well wouldn't know that was a problem because they're not feeling it.
The other things that often happen is that people with diabetes, their feet can often change shape. There's many different reasons for that, but the muscles that lift the toes become stronger than the muscles that bring your toes down, for example. So you'll often see people with diabetes who've got clawed toes, and therefore, rather than when you walk, rather than walking on pushing off on your toes, you're pushing off on the balls of your feet. So the pressure goes up. So if you imagine you've got high areas of pressure, then again the blood that does get down there is pushed away because the pressure keeps it away. So physically you can't get blood down to that place. Another reason why you can't then fight that infection. So you've got areas of high pressure, low blood supply, you can't feel your feet. That's why people run into problems. And the problems that people get are most frequently foot ulcers. Foot ulcers it's just a wound in the skin for the reasons I've described. People can have poor blood supply, so you can have what's called ischemia in the feet. So you can have ulcers due to poor blood supply or due to a wound and infection. And those need specialist foot care.
The most important thing is prevention, obviously, and that the number one thing there is good sugar control, actually maintaining a good level of sugars and not allowing them to go high for any length of time will, to a large extent, prevent a lot of the foot complications. Some people are just unlucky, and despite good sugar control, they will still get complications. In terms of nerve damage, it's a one-way street. Once you have nerve damage, you won't recover from that. But there are ways of minimising the problems associated with that, with good self-care and self-monitoring. In terms of circulation, the best way of managing a poor circulation is to walk, and to keep the circulation that is there, keep it going for as long as possible, and keep moving as much as possible. But also take the medication that's prescribed for you and go to your checkups regularly. That's very important.
It's important for people with diabetes to inspect their feet every day, and it's not just going, look, my feet are here and my feet are still here. It's actually washing your feet every day, inspecting in between your toes every day, getting somebody who knows you very well to look at the soles of your feet every day to make sure there's no problems, because if any problem appears, you need to be seen by somebody fairly smartly.
I check my feet every day to make sure there are no blisters or cracks or cuts or anything, and if I had a cut, I would keep an eye on it and go and get medical help as soon as possible if I thought it needed it. I wouldn't ignore anything on my feet and again, never. Because without your feet you can't get about, can you?
As you know, we're going to check your feet on usually an annual basis, but it's quite important that you check your feet on a regular basis as well, and self-care is the most important thing when it comes to the feet and diabetes. So we have a leaflet about the 10 steps looking after your feet when you're diabetic. So the most important thing is that you wash and dry your feet every day, and just be careful to dry in between your toes, because you can get a fungal infection or athlete's foot if you don't dry in between your toes carefully. And then you need to moisturise your feet every day with a good quality moisturiser. You need to examine your feet every day, and if you can't do this yourself, if your eyesight's not very good or you can't bend very well, then you will need to ask someone to help, or maybe put a mirror on the floor somewhere so that you could actually see your feet in the mirror. It's quite important to cover any breaks in your skin with just a clean, dry dressing, nothing fancy, and then report it to a health professional straight away. Don't use anything sharp on your feet, such as knives or any corn plasters which have chemicals in them which could actually burn your feet. Be aware of the extremes of hot and cold. It can be quite dangerous to use hot water bottles, electric blankets and things like that, because you may not be able to feel the heat of these things, and you could easily burn your feet. Similarly, you want to make sure that you're not too close to the fire, and that when you get into the bath that you've checked the temperature of the water before you get in. It's very important to have good diabetes control generally, because that will reduce the risk of any complications to your feet. And it's very important to check your shoes on a regular basis. Just put your hands in your shoes every day before you put them on, and make sure that there's nothing rough in there, that the dog hasn't dropped a bone in it, or the child hasn't dropped a toy in it, or anything like that. It's also very important to have good quality, good fitting footwear that fits right for you, and to get that checked on a regular basis if you're not sure how it fits. It's quite important not to walk around with nothing on your feet, because you may easily step on something and not realise that you've stood on it. And if you're classified as a low-risk diabetic, it's quite okay for you to cut your own toenails, but just make sure you don't go digging down the sides of the nails, because you may cause an ingrown toenail which could cause an ulcer at a later date.
Okay.
Because you're a low-risk diabetic, I would say it would be okay for you to wear flip-flops, but generally speaking, they're not particularly good for your feet.
Okay.
And the rule that we usually have is that the shoe holds on to the foot shouldn't have to hold on to the shoe. Okay. So try and find something with a fastening on it that holds itself onto your feet. If you do in the future find that you're having problems with the nerves in your feet, that you can't feel very well, it's very difficult to then go and buy shoes, because you can't tell if they fit properly or not. So the best thing to do is, before you go shopping, stand on a piece of paper, draw around your feet, mark them left and right, and take those templates shoe shopping with you. So then you put them in the shoe, and if the paper crinkles, the shoe's too small. It's an easy way of just checking. If you do buy a new pair of shoes, it's always a good idea, if you've got nerve damage, to wear a pair of white socks. Because if you do get any blisters that you can't feel, you'd be able to see if there's any leakage coming through into your socks. And it's worthwhile with a new pair of shoes always checking them regularly to make sure you haven't got any blisters. Okay?
Okay, thank you.